evening and welcome back to blackdoctor.org. Ask Dr. Renee show here at blackdoctor.org. I hope that you all are having a wonderful wonderful Wednesday. You guys, I am a day behind. Terrific Thursday, thankful Thursday. You know what happened? I traveled yesterday and so now I'm off. Do me a huge favor. Share the broadcast. Share. Today we are talking about something that is very important to our women in our community, which we know that Black women, we rule the world, right? So Fibroid Awareness Month is the month of July. And this probably will not be our only conversation about fibroids this month, so stay tuned. But I wanted to have this conversation because I like to bring you guys stories, and I want you guys to understand that you are not alone. So I have a really fabulous story from one of my sorors and a friend of mine that I met volunteering. And I think that you will be inspired by it. Plus, she's having an event that you can attend to learn more and hear from some physicians. So I need you guys to let me know where are you watching from. Oh, look, we already have 2 viewers that said they have fibroids. No, one person said what's fibroids, and the other person said they have fibroids. So very interesting. But please let me know where you're watching from, and don't forget to share the broadcast because I guarantee that you know somebody, and maybe they didn't tell you, but they have fibroids. Trust me, because it's that common. So please share away. And if you're watching on whatever platform you're watching on, make sure you share the broadcast and make sure you've liked our page and all that great fun stuff. And yeah, I will introduce my guest now. So welcome to the show, Dr. Joy. Take yourself off mute. Okay.
Thank you so much. I appreciate you. Thank you for the invitation.
Oh, of course. So I'm not even going to belabor the points. We're going to get right into it. Oh, good. We've got some people tuning in from New York, Charlotte. Thank you. South Africa, East London, South Africa. Lovely. So, Dr. Joy, how did you find out about fibroids?
Absolutely. So I'm going to be honest. I found out when I went to the doctor and I noticed that my iron was dropping. So literally, I was really fatigued and tired, and I went to the doctor and they noticed that my hemoglobin was low, that my iron was getting low. So I was prescribed some iron pills, ferrous sulfate or iron pills, like, oh yeah, just take this. A lot of women tend to have lower hemoglobin levels or iron levels because of their cycle. But then it seemed like it kept dropping. And that was when it's like, okay, the bleeding is coming from somewhere. What does your monthly cycle look like? Your menstrual cycle look like? And I'm like, well, it's normal to me. And that's the one thing, let me just say this, what's always interesting is that when people ask the question about, well, how's your cycle? Is it heavy? Sometimes we don't necessarily know because it's normal to me. I don't know what a light cycle is or a heavy cycle. So I'm like, well, it's normal to me. And so eventually I did end up going to my gynecologist, who's all in Michigan, who's also a phenomenal soror. But so I ended up going to her, and she was like, she sent me for an ultrasound. And from there, she started speculating fibroids when I had an annual exam. And so she could feel, something there. So I ended up having an ultrasound. And literally, though, what ended up happening, I was at work at the hospital, and literally there was like a gush. And I'm like, what just happened? And thankfully, I tend to wear all black bottoms and underwear and all of that. So nothing came through, but still I'm at work and I feel this gush. So I go to the bathroom and it was like blood everywhere, just red, bright red blood everywhere. And so at that time, my primary guy was actually on maternity leave. And so I had to call someone else. It was a big deal, but essentially that was when during that time frame, the ultrasound came back and it did show that I had fibroids at that point.
And fibroids are benign tumors. They're not cancerous. And they really don't know still where they come from, unfortunately. We don't know the cause. We just know that, unfortunately, they tend to really affect Black women unproportionately. And, honestly, thankfully, we don't have them and they actually do end up sometimes being genetic. No one really in my family has any fibroid issues, but I know so many people that do. And we've done a lot of shows about fibroids because of this. But what you said was such an important point that we've talked about over and over again, but we must say again, you need to realize that going through 4 pads before noon is not normal. And a lot of people don't realize that because that's normal to them, like you said. But that isn't normal. And it also is not normal that you have to take, Motrin, maybe 600 or something to get through your cycles. All these things can be signs that you might have fibroids because you are having extreme pain and you're having really heavy periods. So I think it's really important that we have these discussions, especially with younger girls when they're starting their cycles, because a lot of these people actually start having their fibroids start growing at that age. So by the time they're our age, it's like, oh dear God, it's just unbearable. And you didn't have that problem, it sounds like, because you would have known, but people have fibroids that literally look like they're carrying and they're having a baby. So it's because those fibroids have grown and grown and grown and grown and grown over time. So if you imagine if you 13, 14 went to the doctor and they said, oh, this is what the problem is, and they did something about it then, because now there are procedures, and we've done shows about it, and I will do another one soon. We've done shows about, there's a new procedure out there that actually they burn them, and so far so good. They're not coming back. And so you want to try and figure out what is the best method for you, because unfortunately a lot of times they do grow back. So you want to figure out, have a discussion with your doctor and figure out what it is, what procedure will work best for you. And also, and I know, doctors will tell you if they're not bothering you, you leave them alone. You don't do anything.
Right. And, so I will tell you, so mine did grow back. So that was about 12 years ago, but I did have surgery September 2021 because, there was growth. In terms of genetics, same thing. So I'm the youngest of 5. There's 4 girls, 1 boy. Of the 4 girls, 3 of 4 of us have had fibroids. There's 6 surgeries amongst the 3 of us. 4 myomectomies or just fibroid removals, and then 2 hysterectomies.
Yeah. So see, that's what you should, this is why we stress this at Black Doctor, especially I do. This is why family history is so important. So important. It's not good to say, oh, so-and-so just died. No. We kind of need to know what happened, because whatever it is, it may be something that means that you need to have testing earlier. I just had heard a story about somebody who had a parent that had colon cancer, and they are fighting to get a colonoscopy.
Right.
No, if you have a parent that has had prostate cancer or colon cancer, you need to be screened 10 years before they were diagnosed. That whatever age they were diagnosed, 10 years before that is when you need to start your screening. So if your mother had colon cancer at 40, you have to start at 30 with your colonoscopies. So that's why family history is so important. And you could, you didn't know, but you were like, oh, but you knew that other people in your family had fibroids. So then you weren't completely oblivious to, oh, that's what this is. But then there's other people that no one says anything. Or if you're adopted and you don't know your mother and she wasn't able to tell you, oh, I had fibroids and, I had a hysterectomy at whatever age because of them. And trust and believe you don't have to have an hysterectomy necessarily. That's a discussion you need to have with your doctor. So don't think that that's the end all be all. And that's what second opinions are for, because if you do receive a physician that tells you that, perhaps you need to get a second opinion and talk to someone else. Because if you do want to have children, you can still. And I know people who have had a fibroid grow and a baby grow at the same time. And you know what?
Very true.
Babies are probably now teenagers, about 20 something years old now. I'm thinking of one patient in particular, but yeah, so you need to definitely have these conversations and understand that, yes, people experience cramping when they have their cycle, but severe pain, no. I always say there's a difference between discomfort and pain. Discomfort, I can get through. Pain is those people who are skipping school because they are in that much pain, or they're bleeding that much they can't walk around. That is a whole nother story, and that's somebody who needs to go to the doctor. And even if your daughter's only 13 or 14, you need to call the OBGYN and make her an appointment, because she needs to be checked at. The pediatrician will not be able to handle this. This is something that she needs to definitely talk to the OBGYN about. So you 12 years ago, you had a myomectomy then?
It was a laparoscopic. So yes, I
Laparoscopic.
did.
Okay.
Yep. It was laparoscopic. So it was a lot more minimally invasive
Yep.
than an open procedure. And so I did have that. And initially, at that point, I did have it done by a fertility specialist. A reproductive endocrinologist is the one that actually did that particular surgery, because I was really concerned with, I worked with him in research, but I was really concerned with the scar tissue.
Yep.
And I knew that I wanted,
yeah,
to have children. And so that's where that decision came from, to have him do it. So I did have a minimally invasive procedure. What ended up happening though is my iron dropped even lower when we were doing the surgery. And so that's what actually caused me to have to stay in the hospital for a couple of nights at that point.
Okay, so did you before you even, they ever saw you had fibroids, did you have anemia? Did you have low
Yes.
iron? Okay.
Yes.
Because I'm somebody who I just run on low iron.
Yeah, and it started, actually when I was little. So it was like, when I was, much younger, always anemic. And then this would just seemed a little different, and it did drop lower. So I did end up having to actually have a transfusion, go in and have the IV infusion, I should say.
I was going to say there's women that, it's just horribly low and they have to have iron infusions. But I've heard these iron infusions are amazing though. And they feel a whole lot better, because you go from like not being able to get out of the bed to all of a sudden you have energy.
Yeah, it's like, whoa. Yes.
So yeah, I have heard that. But definitely, please make sure that you talk to your doctor. This is why it is so important for women to have their annual exams, because a whole lot can change in 1 year. A whole lot. And you need to, and you need to pay attention to what's going on. And the some fibroids, they grow because of hormones that are in your body, and just there's all sorts of things. And like I said, they've done research, they're still trying. Somebody said that relaxers, this is still something that they're trying to research. I don't think that has been scientifically proven as of yet, because I know many a natural woman that unfortunately has fibroids and has had a myomectomy more than once probably. So, it would be great if we had that and that was the answer. That'd be awesome. But we don't have that as an answer as of yet. There are people that believe in certain diets helping. Perhaps they do in some way, shape, or form. But like I said, I'm a scientist, and I know you are too. And, it has to be scientifically proven for me to say, okay, yeah, that works. But you can try and see what works for you. And, if it works, great. If it doesn't. So 12 years later, what happened to take you back to September 2021?
Yes. So essentially it was about 2018. I started noticing the same thing. I started feeling fatigue again. So let me say this. I've never had cramps. So the cramps was never an issue. It was the iron. That's what actually caused more of the alarm. Was like, wait, what's going on? So 2018, started feeling fatigue again. And then I ended up going to a hematologist again, and he ran everything. He's like, yeah, it's really low. He was like, are you, and then the thought is, are you bleeding internally? There's some bleeding or something going on. And so that was when I ended up going back to the doctor. Now, I will say, from the time I had the minimally invasive procedure to 2018, I still would regularly have ultrasound. So they were still watching them all the way. The one thing with watching though is, and this was the decision that my doctor in DC and I ended up making, and this is why I had the procedure last year. They were not bothering me last year. But the one thing you have to think about when you're just watching them or wait and see is the growth, because if they get too big, it may end up being an issue with them, with how they can actually go in and get it out. And so that was why we made the decision, let's go ahead, do the surgery last year. But essentially 2018, it started with the iron again. And then that's when we ended up saying like, okay, you know what? They're definitely growing. We looked at previous ultrasounds as a gauge, and they were getting large. A couple of them were getting larger. And so what happened was, I ended up going back to the original physician, and he was just very nonchalant, like, get a hysterectomy. And it broke me down. Yeah. And so it really broke me down, because this was someone that I trusted, someone that I had a relationship with. And I'm like, huh? Because again, I didn't have any symptoms. They weren't bothering me, or anything like that. And
And
he's like,
please,
just
if
get
you
a
don't mind,
hysterectomy.
tell us your age. What was your
I'm
age last?
43.
Exactly. So, and he was
Yeah.
talking about hysterectomy when?
Yeah. And I was like,
No, when
nah.
was this? How many years ago was this hysterectomy was he talking about?
Yeah, this
Was
was
this last
2018.
year? Oh, 28. So you weren't even 40 yet, right?
Right. Right.
No, see, that's just awful.
Yeah. So I was like, no. So anyway, so I had straight poker face. I'm just being honest, like, I'll reach back out. I'll let you know. And so I left. I literally got in the car and I called my primary gynecologist, again, a good friend, all of that. And she answered. I'm like, ah! And I just started screaming on the phone, crying. Like, you're telling me I have to have a hysterectomy. She's like, whoa, 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 calm down. She was like, there's no way, because I've seen the ultrasounds. No, you don't need a hysterectomy. I don't know what's going on. And that's all I'm going to say about that. She's like, I don't know what's going on, but no, you don't need a hysterectomy. So then the researcher in me kicked in. And I immediately, when I got home, I started researching fibroid specialists at Hopkins. I was looking at Hopkins, Emory, Cleveland Clinic, University of Michigan, all the top hospitals. I was like, oh no, this isn't how this isn't how it's going down. I for sure need a second opinion. And so I did end up finding a fibroid specialist, Dr. Marsh, who was going to be at the event on Saturday at University of Michigan. And so I made an appointment the next day. The next day, I also immediately had my records transferred the next day. And then the appointment was about 4 or 5 weeks later. Went in, she looked at the record. She's like, okay, I'm still going to do my own imaging. She was like, but there's absolutely not. You don't need a hysterectomy. Absolutely not. Just looking at everything, no. And so she sent me for an ultrasound, but also an MRI. Now, usually a lot of times, it's always ultrasound, but she did do the MRI as well. I ended up she sent me to another physician, another minimally invasive surgeon. And same thing at University of Michigan, you don't need a hysterectomy. Like what? So, all of this is like, you do not need a hysterectomy. And so I ended up moving. I moved to the DC area from Michigan. Dr. Marsh had a recommendation. Awesome physician at Sibley in DC. And so we ended up again, more imaging, more ultrasounds, all these different things. And so we made the decision again to control the cut, the incision. So the minimally invasive, there are like 3 or 4 small cuts. And so she was like, because of the size of one, I do want to do an open procedure. And then I'll just connect. It was a conversation we had in terms of the cosmetic piece of it. Yeah. So she's like, I'll just connect it so you'll just have one scar. So you don't have to worry about multiple scars. I was able to control the time in terms of it was time where I had time off and vacation time, so I could control. So that was why, again, it wasn't a matter of the cramps. It wasn't a matter of I couldn't eat. I know there are people, sometimes the fibroid does press on the stomach. Now I will
bladder,
tell you, it did start pressing on my bladder. So I did start having frequent urination, but it wasn't where I have to have a surgery right now. Again, really 2021 was being able to control, making sure that it was that bikini incision, and also because of the timing and the time frame. When I woke up from surgery, this is when she ended up saying, okay, we got all of them. We took even the smallest one. We took everything in terms of the fibroids, because it's very clear you're prone to fibroids. So she said, we took all the fibroids. Your uterus is good. You did lose a lot of blood, but your uterus is intact. And afterwards, that was when I was happy. And I'm like, oh, thank God. I have my uterus. I'm really excited. But then a sadness came over me. And this is where advocating for my uterus was birthed. There was a sadness because I'm like, my privilege is the reason why I still have my uterus. And a lot of times we talk about privilege, we talk about just white privilege. But no, my privilege, because of the education, because of access, I could call a physician friend, soror, and say, talk to her. I knew what to do because of my background in research. So I knew how to navigate the health system. I knew what to research. I knew I had insurance that allowed me to go wherever I wanted to go. I had transportation to drive from where I live to Ann Arbor, and so all of that. And then it was sadness because I'm like, what about those women who didn't have access?
Right.
And they don't have their uterus because they don't know, or they do not have they didn't have the proper education, or they weren't properly informed about everything.
Yeah. And that's why these shows are so important. We have somebody that said they flow 14 plus days with clots the size of an apple sometimes. This has been going on for 3+ years. You need to talk to your doctor. And if you've been talking to your doctor and your doctor is not listening to you, you need a new doctor. So there's no reason to stay with that person if they're not listening, because that's a lot.
And Dr. Renee, this is my philosophy on second opinions, right? I personally feel like in terms of, and let me share this with the audience. So you see, Dr. Joy, I'm PhD, not MD. So I do want to clarify that I'm not a medical doctor. I have a PhD in public health. So it is PhD. But I do want to say this in terms of for clinical doctors. I personally believe that if you have a doctor that has a problem with you getting a second opinion, you already need another doctor. Why? Because the doctor should be so confident in their diagnosis and their treatment. You can go ahead and go somewhere else. I know that what I am saying is the best method. And guess what? You're going to come back anyway. That's one thing. But then the other thing is, I want what's best for you as a patient. And so if this is not best, I want you to go somewhere else where you can get the proper treatment.
And you know what? Really great doctors will encourage you to go get another.
Exactly.
They will encourage you. They'll say, oh, go and, call such and such. And, they might even give you recommendations of other, specialists in the area.
Exactly.
Because a lot of times we do talk together and, try to figure out what would be best, for people. So, yeah, that you need to definitely check your doctor, because that's crazy. Sometimes somebody asked about hormones and birth control and fibroids. So when they can manipulate the hormones, sometimes they can stop the growth. So that is why sometimes they will put you on different types of birth control to control that. That is why.
So I do want to share this. So one of the things that happened with me when I mentioned at the beginning, when there was just this gush that ended up happening, that cycle went on and on. And so there was an OB-GYN who ended up putting me the same thing, putting me on birth control pills. And it was a very high dose to stop it. Because again, remember, I already had the issue with iron. So I'm bleeding like this excessively, and it was easily a week. So they ended up putting me, it was very high, like 4 pills a day to try to quickly stop it.
Yeah.
Yes. Mm-hmm.
Yeah, definitely. And the other thing, I saw something else. Can fibroids stop a menstrual cycle? I've not heard that. Quite the opposite, actually. Like she said, that gush. Yeah. So usually people who have fibroids have very heavy cycles. If your cycle stopped, then that might be something else. But yeah, usually it's a very heavy cycle, unfortunately. So, but yeah, that is awesome that you like you said, it's privilege that you can call somebody and say, hey, what about this? What about that? Unfortunately, there are so many, and I don't know the statistics, but there are so many Black women, unfortunately, that have had hysterectomies that did not need to have them. And it's unfortunate. The fact that somebody would look at you before 40 years old and say to you, you need to have a hysterectomy is just insane to me.
And it was so nonchalant. It was like, get a hysterectomy.
I hate to say this, but this is why I don't have a male OB/GYN. But I know some great ones, because if anyone watches the show, they know my bestie, Dr. Dre, is a phenomenal OB/GYN. But that is why I had always been scared before I've met a handful of black male OB/GYNs that I think are amazing. But I just, especially Hand That Rocks the Cradle? Yes, that scared me to death. And then stuff like that. Like, okay, like, are you serious?
Yeah.
So, yeah, and it's unfortunate, like I said, that so many people get that, and then the doctor knows best, so then they go through with it when they didn't know, I could have asked another doctor, and they probably might not have agreed. And something else could have been done, another plan of action that might have, been a better fit for you.
And here's the thing, some people make that decision especially if they've had children. Some people make that decision that I do want to just have a hysterectomy and be done with it. But the
Right.
point is just, for anyone listening to just make sure you have all the information and
Yes.
all the facts, and you make the decision that's best for you.
Right.
And that's the whole thing.
Yeah.
Is
And the
making
other
sure
thing, when you have a hysterectomy, that's going to send you into early menopause. So that's
right,
another thing that, at 39, you might not want to deal with.
right,
Because think about it, you're going to probably have to take hormones for a lot longer than you would if you went through regular menopause, because you started so early, and your body probably can't handle, all of that right now. So I'm glad that you did get that second opinion. So please tell everyone about your event, and I'm going to put the thing up right now.
absolutely. So again, Advocating for My Uterus is a nonprofit, and it was started essentially because of the situation in terms of what I went through. The doctor, Dr. Sean Davis Walensky, again at Sibley, she was like, you got to do something. Because I will tell you, it was I was an anomaly in terms of my bounce back and how everything happened. Like literally within the day I was just discharged, I was walking a mile, and we're talking a full open myomectomy. And so she was just floored. It was I was grateful, but it was a really great process. But whatever the case, I will say that this also leads to the importance of overall health.
Yes.
And that is,
yes.
so I'm an active walker. So I walk daily. That's a stress reliever for me. During this process of preparing for the surgery and when I had surgery, I was very careful about protecting my peace. Very careful about protecting my peace. I'm a vegetarian. It's all these different things that were in play. And I do believe that did help attribute to a faster
recovery.
Healing. Mm-hmm. Yes.
Definitely.
Yes. And so at any rate, so again, I felt like my privilege, the education, all of that. So started Advocating for My Uterus, again, a nonprofit designed to really help women and those who love them, help them learn about and bring more awareness to different reproductive health issues. So not just fibroids, but even endometriosis, polycystic ovarian syndrome, menopause, and even heavy cycles as a whole. There is a portion of Advocating for My Uterus that is going to try to help with period poverty and connect with different schools and lower socioeconomic areas to provide tampons and pads for young girls in those areas as well. So the first event for Fibroid Awareness Month, and again, something that's near and dear to my heart, is this Saturday. It is from 11 a.m. to 1 p.m. I'm happy to have Dr. Marsh. Again, that is the Dr. Erica Marsh from University of Michigan. She is the physician that I went to for that second opinion. And so she's
one of, I think it's 0.2% Black female fertility doctors in the country.
Yes. And she is a phenomenal fibroid specialist. This is a side note. I'm just going to say this for the sake of it. I did have my eggs frozen. And so Dr. Marsh was the fertility specialist that I did go to for egg preservation as well. So at any rate, Dr. Marsh will be there. We're also going to have a component with mental health and fibroids, because there is a component of that goes into it as well in terms of anxiety, depression. Mm-hmm. And then we're going to also have some mindfulness at the end with Jasmine Hall, providing some gentle chair yoga as well. So we'll have the therapist, we have the fertility specialist, and then we have the meditation and yoga practitioner as well.
So you guys, I have the link scrolling at the bottom, and I'll put the link in the post, but please make sure that you tell people about this, because I think that it's going to be a great event, and you'll have some great information, and we need to keep the conversation going because so many people just have no idea. And, it's not normal to bleed so heavily. It's just not normal. So you need to make sure that you have the information, and because sometimes people don't know who to talk to. Okay, well, your 12-year-old, yes, you have a pediatrician, but you do need to talk to the OBGYN. And, and they don't know these terms like myomectomy is, when you remove the fibroids individually, and then laparoscopic is when they go in with the camera and in a tool, I guess you could call it, and they do it, and it's all really blindly almost. They look at they look at the screen, and they are going through your system, and they pull them out, and it's little incisions like this that they do, 3 little incisions, because they have two tools, and then one for the camera in your belly, and And of course, obviously that recovery is not as bad as when they open you up with a myomectomy. But like you said, it is so important for us to keep our health. And I mean, I'm not the healthiest individual myself. I tell everyone, I just lost weight, but I still have some more to go. But I do not have high blood pressure, never did. I'm not on blood pressure medicine, but all those different risk factors that we talked about with COVID, obesity, hypertension, diabetes, all those things, if you have all those things and you have to have fibroid surgery, that can really, really, really cause you to have a very long recovery. And that can make your surgery more complex.
Absolutely. And, the other thing I want to share in terms of, when we think about fibroids is even if you feel like, I don't have fibroids, the chances of someone that having fibroids or at least getting diagnosed is very high. So I would rather have the information and not need it than to need the information and not have it. So again, if you can, come out, share the information to make sure people are aware and they know what to look for in terms of signs of uterine fibroids, that would be helpful.
Yes, definitely. And I also was going to tell you about the period poverty. I'm actually a Thinks ambassador. And so, and I have heavy periods and I use Thinks. And if you've never heard of Thinks, then you've not been watching me on Black Doctor long. But because I'm an open book. And so I've been using Thinks for, oh God, it might be 7-8 years now. But it's been a while. And I love them. They are amazing. They are money saving. And for period poverty, they're wonderful because they are literal underwear, just like your regular old cotton underwear, and you wash them and you wear them. So, whereas tampons and pads, it's a one-time thing and they're done, right?
That's true.
But with period panties, you can have them I mean, if you take good care of them, they'll really last you a good 2 years probably before you would need to replace them. But and now, because they have of course evolved, now they have different absorption. So we have from whatever you want to call the beginning to super. Super is what I wear, and they're amazing. They're life-changing, game-changing, I must say. And actually, we are having a special right now that, of course, I didn't remember to post about. But I'll try to remember to put that in the post too. But yeah, that is another thing. And actually, I'll tell you should probably hit them up.
Sounds good.
Yeah. But yeah, so everyone, please, July is Fibroid Awareness Month. Thanks to my friend who has been on here, Tanika Valburn, and she was the one that went to to DC and got fibroid awareness acknowledged. So thank you to her and the White Dress Project. That's her nonprofit. But it is so important all of the days of the year because somebody is bleeding some time of the year every day, and Black women, like I said, are highly, highly, highly affected by fibroids. And so you need to please, please, please make certain that you have your annual exams. If you are in pain so badly that you are missing work or school or have to take a whole lot of pills to function through your cycle, you need to tell your doctor. And if they're not listening, you need to find another one. And I've said it before, I'll say it again. There has been studies done that you get better treatment when your doctor looks like you. So if you can find a Black doctor, please try to find one because you will probably get better care. But I guess that's not always the case, but there's studies been done and it has been the case. So please make sure that your doctor is listening to you, because if they're not listening to you, then you need to see somebody else. And if you are someone with fibroids and you're told you have to have a hysterectomy, please, if you want to keep your uterus, then go and seek a second opinion. If it doesn't matter to you, fine. But if you would like to keep your uterus, seek a second opinion and see if maybe there's something that person missed or they just made a rash decision. I don't know. So,
and Dr. Renee, I do want to share this, as well. And again, this is nothing against men. Please know that. It's nothing against men. But the 4 women that I went to after he said, there were 4 women I went to after he said get a hysterectomy. Every single one, you don't need a hysterectomy. All women, all minority women.
Yeah. So, like I
We're like,
said,
you don't need a history. So that was the other thing. All
yeah.
minority women, Dr. Sean Davis Walensky, a Black woman, Dr. Maddie Scott Phillips, a Black woman, Dr. Erica Marsh, a Black, and so, yeah, phenomenal care. Phenomenal.
Yeah. So just, I mean, we are needles in a haystack because, in case you haven't heard, we call ourselves unicorns because there's only 2% of all physicians that are Black women. So it is difficult. Blackdoctor.org is a great resource. You can go to the website and you can put in the specialty you're looking for, and they will tell you where there's a Black physician in that area. And you tell them your zip code, and they can let you know if there's Black physicians in that specialty in your area. But also, talk to friends and family, and talk to other Black physicians. Like, she's having this event, talk to other Black physicians and, see if they say, oh, I know somebody in whatever state or whatever. So you never know. And then nowadays, I mean, the pandemic has had a few light bulb moments that were actually a good thing. And one of them is telemedicine. So even if you're not in the same state, you might be able to have a telemedicine visit and talk to a physician, and maybe then through that conversation, they can decide if maybe you need to go there for a procedure or if they can find you someone close to you or whatever. So trust and believe, there's always a way. Nowadays, there's always a way to get it done and get it done correctly. So thank you so much, Dr. Joy, for your time. I know your event is going to be amazing. If I didn't have something already Saturday, I would be attending myself. But please, everyone, make sure that you click on the link, share this broadcast, because I guarantee, like you said, you may think you don't know somebody, but maybe they just didn't share it with you. They just didn't tell you. And then also, don't forget to get your family history. Ask grandma about her history. Ask, it's important if when you go to the doctor as a young teenager or whatever age, when you go to the doctor, if you don't know when your mother started her cycle, that's something that the doctors like to know, because usually you're going to start around the same time. So these are all things. Ask grandma, ask mom, ask auntie. Have a conversation. At the next family gathering, what holidays do we have coming up now? None, Labor Days in September. But next family dinner, you all need to have a conversation about your family history and find out. Make sure you write it down and make sure somebody has that information so that if something happens, you start feeling whatever pain, wherever, here or there, when you go to the doctor and the doctor asks you about, well, does anyone in your family have such and such? You can say yay or nay, not I don't know. Because I don't know is not very helpful, and it can delay your diagnosis. So that's why it's important for you to know what's in your history, because it can help speed up your diagnosis. And I think everyone knows that the earlier we find out things, the quicker we can get things resolved and the better outcomes we have. So whether that's cancer, fibroids, whatever, the earlier we know, the quicker we can do something about it, better outcomes. Because now she doesn't have a lot of scar tissue. And when she decides to have children, she probably won't have any problems having children. But had you waited and they grew into baseball size, or grapefruit size, tumors, then you have to have a different kind of procedure that may not have the outcome that you wanted. So
exactly. Yeah. And just know, talking about the menstrual cycle, we've made it so taboo. We really need to start talking about that again, but amongst each other. It's not taboo. We shouldn't have to hide our pad or our tampon or whatever when we go to the bathroom.
Right.
Because it's thought of like it's ew, it's disgusting. No, it's natural. Right. It's a part of, yeah. Let's talk. Let's have a conversation.
Like I said, I'm a Thinks ambassador, so I talk about periods all the time. It's not a big deal with me. And, I even posted a picture of me in my Thinks underwear, which was way out of character, but I had to get the message across because we need to have these conversations, right?
We do.
And so, and if we can help anyone, we want to help them. So I'm glad that you started this nonprofit advocating for my uterus. I love the title. And everyone, please, please, please make sure that you check her out. And can they follow you on social? Do you have a social for that?
Yes. So on Instagram, it is Advocating for My Uterus. Oh. And then also the website is advocatingformyuterus.com.
Okay, so you guys got that. Advocating for My Uterus
on Instagram.
Yes. And then that's the website too, .com.
Yes.
So easy peasy, lemon squeezy. I hope everyone is going to go follow her And then everyone will please, if you don't need to go to the event this weekend, then make sure, and it's a virtual event, you guys, in case we didn't mention that, then you need to make sure you send it to someone.
Yes.
Send it out. Send it to your girlfriend group or your sorority sisters, your church friends. Send it out. Your nieces, whatever. Send it out. Okay.
Yes,
thank you,
please.
everyone.
It's virtual and it's free. So thank you so much.
Virtual and free, you guys. You can't beat that with a bat. Okay.
Thank you so much. I appreciate the opportunity.
You're welcome. Thank you for coming and spending time with us. You guys, I will see you again next week at 6 o'clock Eastern Standard Time. Bye.